Madeline. I'm Dr. Bundrick. So you're here for an infection. Tell me when your problem started.
They all started about a year and a half ago in July of 2021.
July of 21. And had you ever had trouble with your bladder before?
No, never. It started with like that initial infection in July, and then since then it was a pretty bad infection, and then since then it's just been persistent.
So you've never had an infection, and you've never had trouble with your bladder until you got this bad UTI. And since you got this bad UTI, you've had symptoms basically ever since.
Yeah, pretty much.
So you're looking at basically you've had problems for a year and a half, right?
Exactly.
Okay. And what were your first symptoms? How did this start?
When it started, I had like the classic UTI, urinary, like needing to urinate, pain while urinating, and also my kidneys actually, like I had pain
Both
in
sides?
my back. Yeah, both sides.
Did you run a fever?
Yeah, I had a fever.
Oh, you had
too.
a fever with it also.
Yeah.
Okay. So this is okay. So you had pyelonephritis. I mean, you had not just a bladder infection. You had a febrile urinary tract infection.
Yep.
And so, how were you treated?
I wasn't treated after that. I was away from home, and I thought that I could just.
Oh, you handled it yourself.
Well, I didn't handle it myself. I was fine the next day. Like.
Oh, you got better on your own.
Yeah.
Okay,
yeah,
so this is. Did you take anything, or you just kind of hydrated and it got better?
I just hydrated, spent the night in the bathroom, and the next day I wasn't like perfect, but I mean I was like 21 at the time, pretty resilient. So.
That's
I was
incredible.
right after, yeah.
Most of the time, when you get a fever, most of the time people get really sick, and generally when we see a patient with fever, that's a minimum of 2 weeks of antibiotics, and that might have solved your problem, and you might not be here, but nevertheless, you are here.
Yep.
What symptoms are you having that you've had for the past year and a half?
Just everything that you would think of with a UTI, just like slightly lower level for every single time that I urinate.
So you burn.
Yep, I burn.
And you have frequent urination.
Yep, and I have cloudy and like slightly foul smelling urination too.
And you have urgency.
Yep, urgency.
Do you ever leak because you can't get there fast enough?
No.
Okay. All right. And you notice that you have pressure in the lower abdomen?
Yeah, for sure. And I have like a little bit of swelling too.
Okay. And does your urethra hurt?
Yeah, it burns every time that I pee, and then afterward, for like a few hours afterward, it's painful to move or even breathe, like anything that.
After you urinate? Really? Okay. And what about your urinary stream? Do you feel like it comes out freely?
Yeah, it's pretty
Okay, that's good. And do you feel like that you're empty when you're done urinating?
Yeah.
Okay, very good. And what about intercourse? Does it hurt?
Yeah, intercourse hurts. Anything that moves my urethra in any way hurts. So like intercourse, any like exams, medical
Even
exams.
just running hurts.
Yeah.
Moving.
Yeah, pretty much.
Yeah. Everything's tender down there.
Yeah. Especially right after I urinate.
And so if you had intercourse, would your symptoms be worse the next day?
Yeah. So even like any large stimulation afterward, the next day, the next 2 days, it like really flares.
It's just misery, huh?
Yeah. And then for like a week after, I'm pretty much laid out.
Do you ever remember taking an antibiotic that made you feel better?
I don't, because I've been on so many different ones, but they've only ever been for like a week at a time, so I can never really gauge how well it was working, because my symptoms are kind of not quite cyclical, but there's like periods where it's worse and then periods where it's better. And so I didn't know if it was just a period where it was better.
Gotcha.
Or it was the antibiotic.
And so you've had positive urine cultures during this time?
Yeah. Had about like.
Do you remember what the bugs were?
E. coli, Aerococcus, something. But I can send the.
Aerococcus, Enterococcus?
Yeah.
Okay. Yeah, we should look at those because usually this is you got a bug a year and a half ago, and not only is it still there, but it's recruited friends, and it's just a community of misery in there.
It is not for them.
Huh?
Me, not for them. They're having a great time.
That's very well said. They are happy. They have everything they need. They have food. They have water. They have shelter. And your immune system is not solving the problem for you.
Yeah.
There's a struggle going on in there between your body and these bacteria, and we're gonna help. Okay. All right. Are you allergic to anything?
No, not that I know of.
Okay. All right. Generally, what I would suggest is that let's do. Look at your urine. Your urine today is clearly infected. It's loaded with pus. It's loaded with blood. It's nitrite positive. You have an acute UTI going on. You probably have lived with an acute UTI for a year and a half that's never been eradicated. You probably notice that the symptoms kind of exacerbate and remit, but it's never gone. Right? You never get complete relief.
No.
Yeah. See, this is an immune failure. What color eyes do you have?
Blue.
They're beautiful blue eyes. And almost all the patients, you may have read this before, but almost all the patients that have this problem have light colored eyes. They have blue eyes, green eyes, hazel eyes. Every now and then you'll see a patient with dark brown eyes, but it's not very common.
That's interesting.
Okay, well then what I suggest that we do is you're going to have a positive urine culture today. So we'll get a culture, we'll do a serous test, and the serous test may help us identify other organisms that are in there that the culture will fail on.
Yeah. What is a serous test?
It's a PCR test that's done in conjunction with kind of a high-end urine culture. There are other tests that are similar. Pathnostics is a similar test. So it combines two technologies, and it can be very helpful. But there's no doubt about what you have. You have an infection. Have you been told that you have interstitial cystitis?
Yeah, and I've had doctors just tell me, you have to go vegan, but like a super vegan. You have to eat like whole food. You have to eat like literally no animal products, and basically don't cook your food. Also avoid all these other foods.
Wow.
And that'll control the symptoms.
That's insane, isn't it?
Yeah.
Yeah. That will not work for an infection.
No.
It will not work.
No.
Okay. All right. So what I think goes on with patients with your particular problem is there's an immune system failure in your body. There was an infection. Your body put up a good fight. It failed. The bacteria now live in the lining of your bladder. They intermittently come out into the urine, and you intermittently have positive. Have you had negative cultures also?
Yeah.
Yeah. See, so sometimes the bacteria are just in the lining, and so you can have a normal urine and a normal culture. Obviously, urine cultures are only positive if there's bacteria in the urine, but you always have bacteria in the lining of your bladder, and that's why it's irritated. See, the bladder only knows to do two things. It knows to hurt, and it knows to go. Okay? And people with an infection have an irritable bladder. And you can either have frequency, urgency, you can have pain, but most people have both. So what we'll do is we'll get these tests back, and we'll call you with a plan, and it'll probably be about Monday.
Okay.
But we look forward to helping you. We're going to get you better.
That's great.
All right?
That's great to hear. Thank you so much.
You're welcome.